Hi, guys. How are you today?
Hey, good, Craig. How are you?
Hi, Greg.
I'm excellent. Thank you very much for joining me today. I'm Craig Norman, and we have two special guests here today to talk about managing your Ortho-K patients when you're out of the office. We have Dr. Kevin Chan. Dr. Chan is from the Washington, D.C. area. And Kevin, how are you doing today?
Pretty good. I'm in Virginia. Cool weather, but staying in the office for doing office work.
Okay, great. I'm going to come back to you in just a second about the office if I can, but I also want to welcome Dr. David Kading. Dave is from the exact opposite part of the country from you in the Kirkland, Washington area. Dr. Kading, how's everything going?
Great, Craig. We're enjoying kind of the family time and the increased time to get projects done around the office and think about what's the future, but trying to find the silver lining in everything.
That is great. So, of course, the area that you are living in is one of the hot spots in the country. Can you tell us a little bit about what eye care life is like right now in that area?
Yeah, so we were one of the first to kind of start shutting things down. And as you can imagine, as kind of the reports were coming in, we were, having to make some decisions to do things that nobody else in the country was making those considerations. So as you can imagine, that was a little stressful earlier on. And, most of our optometric colleagues started jumping on some of the same boats to, start dialing back to emergency only and then shutting down the office. And how do we take down our take care of our teams during this. So it definitely has wound down to a pretty isolated office. I am in my office right now, but we're only seeing people if there's an emergency visit. And then it's giving us an opportunity to reach out to our patients in other ways. We're looking to our elderly patients and checking to see if there's anything that they need, if we can bring them food or anything like that, some opportunities to try and engage with our team. But right now it's staying in touch with people via telemedicine. And then if it needs to be a visit in the office, then we take the precautions for that and then see them in here in the office.
Okay, that's great. And I'll want to come back to that. But I do want to go to Dr. Chan again. Is the same situation for you? Are you in the office part-time or no time? How is that working right now?
Yeah, so in Virginia, it's almost a little bit similar, even though the outbreak is coming a little bit later than, Seattle. But we are hitting a situation where, all the patient, not all, but most of the patient has been rescheduled, or we actually, take a proactive step to reschedule them so that they will be more comfortable coming in about 6 to 8 weeks.
Okay, great. So, the topic today is basically managing Ortho-K patients, from a distance, if you will. So I'm very interested in a couple of areas that I'd like to walk you through, and I'd like to throw it back to Dr. Kading if I could for a second. How are you managing Ortho-K patients that you would have expected during the fitting process would have been coming back in the last couple of weeks?
Yeah. Well, so first of all, we started this process quite a while ago. And so as things were starting to wind down, the number of new patients that were coming into the office started winding down even before before we completely shut down. I think they saw the writing on the wall or were realizing maybe this isn't the right time to do new fits. And then we did have several patients who were still coming in for their follow-ups as we were starting to shut the office down for emergency onlys. And so staying in touch with the patients over the phone, checking in with them, and we haven't had to, but one of the things that, is a consideration is if you have to, the patients can stop wearing their lenses and go back to their glasses for the time being. And then we can resume the fitting process and, extend warranty periods or time periods and so forth. But fortunately, we haven't had to. We've been able to manage those patients via phone calls and whatnot. and they've been doing fine with their lenses as they've had. I'm sure that when this is all over, we'll see some people back for their follow-up visits and find out that, maybe they're, got a decentered lens and they weren't aware of it, or they didn't care. And we'll go from there. But for the most part, it's just kind of died off, and people haven't really freaked out about it or been concerned.
Okay. So Dr. Chan, is that the same to you? And in particular, have you had any parents of the children you're managing kind of panic in this situation because they're a little bit out of whack of what they would normally be doing?
Well, I think I'm seeing two different dynamics in my area in Virginia. One group of parents are just freaking out and they barely want to bring these kids outdoor, not even mentioning about medical appointment. On the other hand, there are a couple parents who are actually quite, they want to actually reach out to us and see what's going on, how we can deal with the issue virtually, either calling me or doing FaceTime. And I think depends on the comfort level of the patient and the parent. I think we all respect them, and that's why we keep the door open on a part-time basis, so that whenever they have questions or need any assistance, I'll be happy to help them.
Okay, so that part-time basis, is it scheduled? Is it like the same 2 or 3 hours every day, or is it on an as-needed basis?
I would say it's a little bit more than 2 to 3 hours a day. Typically, my hours set, even though it varies on a daily basis, but I typically see patients from either 8 to noon or 1 to 5, depends on the day and the demand.
Okay, so the part-time basis, is it scheduled? Is it like the same 2 or? Okay, and Dr. Kading, is that similar with you?
Yeah, actually, we don't have any scheduled time. We have team members that are here, but our doctors, for the most part, are staying home and just doing telemedicine. And then if they do see that there are certain patients that they need to see, then they will schedule those patients later that day or even the next day if it's something that can be, a planned emergency. But yeah, we're not having a specific time period that the office is open. We do have staff members here for several hours during the day in case those things come up. But it's not the door is open during these times.
Okay. Okay. And you bring up an interesting point by mentioning the staff. How are they dealing with this situation of uncertainty?
Is that for Kevin or me?
That's for you, Dave.
Okay.
First, I'm going to ask Kevin the same thing.
Sure. When this all started to kind of come down, we had no idea what was going to really be happening. And, my office isn't my office without my team, right? We could move anywhere in the area, and the specialty eye care group is our group because of who we are, our team, our doctors, our employees. And so, we're checking in with them. Each of them get a limited number of hours. They're still working, they're still on the clock, but not as many hours as we used to have. And so it's the sort of thing where we're trying to stay in touch with them and try to be involved in their lives and make sure that everybody's doing okay. And, we've built up some funds within the practice that if we need to, we can help take care of one another. But it's the sort of thing where it's just weird. We're setting up to have a conference call with everybody on the team all together so we can just see each other's faces and kind of connect. It's been all 3 weeks since we've seen each other all together, and we get together frequently as a team at least once or twice a week where we're seeing every one of each other. So it's a little different as it is for all of us socially too. But on the side of these are people we spend more hours with than our family, and now It's different. So we're trying to stay connected with them and make sure everybody's doing okay. I think just like everybody in the country, people want to get back to work. They want to do what their purpose is, and my team, they enrich people's lives so they can succeed to their greatest potential. And we're anxious to get back to doing that.
Yeah, I think so for sure. And Dr. Chan, how about you? Relative to your staff, what is happening?
Yeah, so we are currently working with the skeleton crew and, trying to get our feet back on track, even though, yes, there's a lot of adjustment we have to do. And sometimes you just have to play day by day and really have no agenda about what's going to happen tomorrow. But for us, I think because we're in a specialty place where patient coming in for specific assistance, where they don't, expect me to do any primary eye care or anything general. So I think the expectation is set a little higher for us, and so I'm glad I'm working well with all the skeleton crew and members. And like Dave said, we are a family and we see them more than our own family and home. So it's really important for them to keep a morale, keep the camaraderie together so that we can work through this crisis.
Okay. So both of you guys have mentioned telecommunication in one way, some method, telemedicine, telehealth. There's all kinds of names going around at the moment to describe kind of the similar category. So Kevin, can you answer two questions? One is, has reach out to patients through telemedicine, is it happening today, and how, what methods? And two, how much different is that than a month or 6 weeks ago?
Yeah, this is a really good question. I have a lot of patient and parent who ask me, how can I reach out to you in our office hours? Previously, before this crisis started, I said, feel free to call me back or reach out this hotline. I will be happy to answer the question after office hours. But these days, I'm getting a lot more demand about, telehealth and, can we just ask your questions virtually so that we'll have a peace of mind. And sometimes you really have to go an extra mile for them to feel comfortable. So for us at this moment, we are going to implement some telehealth services on the by appointment only. Not that we try to advocate this telehealth, because for myopia management or specifically for Ortho-K lenses, in terms of fitting and checkup, it's really hard for us to do well during telehealth services. Instead, we try our best to give them resources and guideline about what to do. Basically give them a checklist so that they would know what to expect if something went wrong.
Okay, and so are you using phone for that, like an iPhone? Are you using a specific program, if you will, a software program of some sort?
Yeah, so as you know, there are many different types of software out there right now, and Zoom is one of the many few. And we also have other connection with other outsourcing vendor. They are happy to help us out. But the simplest way is to tell patient, okay, I'll be reachable by FaceTime. I give them my personal cell phone number if needed, so that they will be. People are having common sense and they won't really call you unless they have to. So I'd be pretty comfortable letting them know, okay, I'll be reachable by any means. Okay.
Dave, is that similar?
Yeah, we use a program called Docsy, and I think most people are, a lot of people have heard of this now. I don't think that very many people I shouldn't say it that way. I don't think that as many people in eye care had heard of Docsy Me until about 3-4 weeks ago. But it's a really cool program. And, on a side note, my practice doesn't just do orthokeratology. We do a lot of different aspects of eye care. One of them being binocular vision and vision therapy. And so our vision therapists are still continuing to do vision therapy visits through Docsy Me, and they set up and schedule time with each of the patients every week, and then they see the patient over Docsy, and it allows for a couple of different additional features than maybe just a conversation that we would have over Zoom or FaceTime. It tracks those phone calls. It tracks the time that is in there. There's additional features which we don't use, where you can do some billing through the service, but we don't use that feature. And so our staff sets up a time for the patients to talk with the doctor. And if the doctor is on call in the evening and they want to use Docsy, then they take the phone call with the patient. give the patient the information over email to log in, and then redirect them through to Docsy Me. It just checks off a couple more boxes that makes it a little bit more official, both to the patient as well as to the office. As Kevin said, so much of this is just trying to make it work for the patient. And there's some people who can't figure it out. And so just picking up the phone and, we're not making a lot of money off of telemedicine. And so it's not a super important aspect other than just talking to a person on the phone if we have to. So whatever's going to work for the patient is what we try to do. And if we can direct them to something, we use Docsy Me.
Okay. I would like to make a general comment here for those of you that are reaching out to us on Facebook. There is a place in the comments area for you to write in any questions you might have for these two great guests that we have today. So please do that if you get the chance. I would like to build about what you're saying. I was one of those that didn't hear of Docsy till 3 weeks ago either. And I think that that's happened for many people. It's like how Zoom became part of our vernacular within a very short period of time, as far as relative to a small niche player, and then it became such a really, really big thing thereafter. So Kevin, I'd like to ask you, this must be a scheduling nightmare coming up here, either today or in the future. You have patients that have been on the books for weeks or months, and you need to keep putting them off because there's no specific light at the end of the tunnel yet. Can you share with us a little bit, Dr. Chan, exactly how you are managing that and what your game plan might be going forward?
Yeah, so when I look at my schedule for the week, I typically want to screen through what kind of patient I need to see, as my first priority. Especially for patient with Ortho-K or just in general for myopia management, we typically want to give priority for the patient being treated within the first 6 months or so. Especially for the first day, first week, and first month, those patients do need to see me in person in order to get the best progress analysis. Whereas like for patients who are coming in after 6 months or doing, just a routine follow-up, I will kindly remind my staff to let them know, okay, if you are ready to reschedule, I'll be happy to postpone your appointment until 6 to 8 weeks or whenever you feel comfortable coming back. So that way we can triage the service, based on the need and also the importance of the service.
Okay. And so is it a moving target then, as far as the schedule itself, that if, let's say, if you schedule for a month right now, it's kind of like the sporting events, right? The sporting events are announcing when they're going to be played, and then a week later they're talking about how they postponed it and they're moving it out another couple of weeks or whatever it might be. Is that a particular strategy that you have right now, or are you just waiting to see as this develops?
Well, ideally, we hope to, give ourselves a time frame as to how to allocate all these patients, because, yeah, as you said, it's a nightmare every day for our staff to handle all these patients' need, and sometimes they may not be comfortable coming in until 3 months later. So it kind of throws off our schedule a little bit, but unfortunately, this is just the reality for office to deal with. I'm sure Dr. Kading can comment on that as well. It all depends on the priority and how comfortable you are with the patient. And also you have to assess how the patient's motivation and compliance is. All these things come into play when it comes to who comes in first.
Yeah, I see. Dave Kading?
Yeah, it's going to be something we've never really had to deal with, shutting your office down for 2 months and then starting back up. But I think it's going to phase in. I think we're going to be in a phase-wise approach, but also I think there's going to be a lot of people who don't want to come in for an eye visit because they're overloaded on certain other things in their life, and then there's going to be people who are super anxious to get in. So we can't anticipate necessarily how it's going to be. We have a date of which we are already scheduling patients, and supposedly the governor has pushed us even farther beyond that date. And so we're just going to see how things go as we get closer to it and continue to schedule beyond that date, but also keep those patients that are earlier than that date to see if there's a phase-in period. Also, I think as we're getting closer to the end, as we get closer to the end of April, early part of May, and as we're getting to maybe a period where things are starting to normalize a little bit, I think people will have a different level of comfort, and they may be more anxious to get out and get involved. And then as far as who we're seeing and how we're seeing it, we're likely going to have to be doing different hours and maybe more hours than we've done in the past. If the demand is far higher, it may just mean that we have to work different hours than we worked before. We'll see how that all shakes out as we get closer. I'm a big fan of working on supply and demand, and so we'll fix the supply issue as it comes in, and as the demand hits us, we'll encounter it.
Yeah. Okay. If I could switch gears here just a little bit for both of you guys, and I'll stick with you for a second, Dr. Kading. How are you handling the need for replacement lenses? First, either in OrthoK or other lenses, but specifically to begin with in OrthoK.
Yeah. So we have a program in our office where it's an annual agreement. So people make an agreement, and then once a year they get new lenses. So obviously, anybody in the months of March or April, or some people already for February, they didn't get into their appointment. And so we're reaching out to those individuals and just saying, hey, we realize that you're hitting the time period where you may be wearing your lenses longer than we would like you to, and we don't think that's necessarily going to be a major issue in the long run, but we would highly encourage us to replace the lenses. And particularly if the patients are doing reasonably well, then we'll go ahead and replace the lenses and then just grandfather that visit into when things start back up and just say, hey, we're going to check to make sure. Working with our laboratories, we want to make sure that we can replace the lenses if something is wrong. But many times, once we've had a child in orthokeratology for several years, we don't make a lot of changes to the lenses, particularly if we're effectively managing their myopia. And so kind of taking it on a case-by-case basis, but we're ordering lenses for patients even right now, sending it directly to them, and then telling them that we're going to get them scheduled as soon as this all washes over.
Okay, great. So you are using a direct to ship of some sort from the fabricator, from somebody like Euclid, directly to the patient to be able to get the lenses to them.
Yeah, and Craig, I'll jump right in. Is as we're coming out of this, we're going to find more and more things that we're learning about how to do business better. And that's something that we've done kind of all along, particularly for our established patients, is what's the point of them coming in to pick up a lens after they've already had the eye exam, after we've already determined that their lenses were fitting well, if we're ordering exactly the same lens or maybe a quarter diopter correction more. We don't usually see those patients back and would directly ship to them. And I think as an industry, that's something we want to look at, is what are some ways that we can make patients' lives better by doing things like that, and also streamline some things in the office. And this is kind of forcing people to look at some of those things. On our soft contact lens side of things, about 85% of all our contact lenses are direct shipped to patients. And I think that's something as you may be listening or watching as an optometric colleague to seriously consider direct ship for your patients.
Yeah, that's really good advice. Dr. Chan, is that similar, or are you doing something different?
Yeah, so I second Dr. Kading about ordering or extended warranty for patient during this period of time. And what I would do slightly differently is, especially for patient, we didn't talk much about, patient, doing atropine drops as a pharmaceutical agent. And for those patients, we always want to remind, patient and pharmacy how to communicate better so that they don't miss the refill. Sometimes they assume they run out medication and that's it. That's the end of the treatment. But in fact, you have to rely on the medication continuously, periodically, in order to see the treatment outcome. So for those cases, we do have to, get a really good communication with the parent, making sure they are not stopping the atropine drops right away. Remind them how to do refill, how to make refill seamlessly, by electronic means. And all these things are being managed on a day-to-day basis.
Okay. So life is different. You both said that already, and you are still seeing patients a couple of days a week. Has the occurrences over the past few weeks changed how that is? For instance, are you masking up? Are you gloving up? Are you doing things that maybe you weren't doing before pandemic became part of our vernacular? Dr. Chen.
For me personally, it's not really the biggest nightmare. Yes, it's quite a circus every day, try to chase after people around, and you don't know what to expect for the next day. But for the most part, I think our staff and the skeleton crew has been doing well and supportive of each other. So I think this crisis is just basically like a testament for us to learn something, like Dr. Kading said. It's something we as an optometric community need to learn how to deal with this crisis. And should things come back again, or something, knock on the wood, something really big happening in our world, you really have to step out of the comfort zone so that what to take it to the next level.
So in particular, are you using masks in the office when you see a patient?
I do. I started having masks since about 2 weeks ago. I also wearing gloves, for dealing with patients directly with, tactile touching and stuff like that. And all these things would really give patient and the parent a peace of mind so that they don't feel being apprehensive coming to the office. And we also, by the way, we also check temperature before they come in.
Oh, okay. Yeah. That's really good. Dr. Kading, how about you? When patient visits, are you approaching it different?
I think we just have a whole lot of more of these things sitting around, and we're just constantly using them. To echo with what Kevin had kind of said, is having a routine even within the office and a checklist that we go through on the hour. So when there is a patient in the office, and even as we were heading into this time period of having a certain time periods that we go through and make sure that we're cleaning everything, and doing simple things if we have to, of going up and escorting the patient down into the office if they need. I've heard several clinics are doing that. Have a virtual waiting room, so to speak, where everybody's in their car, and then you go and get them and escort them into the office and ask the family members not to come. Obviously, a parent would be coming with their child in an Ortho-K setting. But those are all important things that we want to do. And, with our staff, trying to have, certain distancing with them. If somebody's in our practice with having an optical, if somebody is, broken a pair of glasses or something in there, it's an emergent situation, then we're going and selecting the eyewear for the patient to try on. So we're limiting the touch, and then all of those glasses get disinfected before they go back on the shelves. But those things aren't happening all that often, but we're working on establishing those types of protocols even now for those types of people.
Right. If you think back 15 to 20 years ago during the whole AIDS crisis and how that changed dentistry, right? Dentistry all of a sudden was masking up and hooding up, and now it's a standard practice. You never go into a dental office without that happening. If I could, Dr. Kading, you had talked a little bit before about the telemedicine aspect, as did Dr. Chen. Is that a billable event? And how does that work?
Yeah. So, just like any type of medical insurance, if something is billable medically in the office, then it's pretty well billable outside the office. So a comprehensive eye exam isn't necessarily billable the same way, but if a patient has medical insurance and they have a medical emergency, then there are certain codes that can be used for telemedicine. And it's generally based upon the amount of time that you are with the patient over the phone. And, the AOA and the Academy, and these different organizations have all put out some really, really good webinars on how to go about billing. I don't pretend to be a billing expert on that, but yes, there are certain codes, and they generally are based upon the amount of time that you're discussing things with patients, and also whether you initiated the call or whether the patient initiated the call. So those are some things to be in consideration for. You know, try to avoid our patients really freaking out like, oh, I just thought I was talking to the doctor, you know, letting either through a staff member who's introducing the patient to telemedicine, or at the beginning of the appointment, you want to consider having a discussion with the patient of, you know, just like a normal visit, we'll be billing your medical insurance. So there may be a deductible if you have not hit that, just to let you know. So people aren't surprised by, hey, I just had a phone call, why did I get charged? So those are certainly things that to have discussions with. Now, with regards to services that are not billable to insurance, or not generally considered to be, like a contact lens follow-up visit and so forth, you know, those things are going to be case by case basis for each clinic as to decide of how they want to charge their patients. Generally, those types of things, and you know, we're billing insurance if it's going to work, but for the most part, we're just trying to make sure our patients are taken care of. And so if we don't get paid anything for a visit, that's going to be okay.
Sure.
We're, you know, the insurance payments for these virtual phone calls are not very high, and so it's not something where you're going to really be running your clinic telemedicine comparably to how it was before.
Sure, sure. Kevin Chan, same thing or different?
Yeah, so currently we are adopting a more linear approach as to billing, because we are just starting to see more requests or demand about telemedicine. So we decide to hold off the billing part, and just to make people at ease first. Otherwise, if you come with, you know, bring up billing process, it will just be another nightmare for us and for the staff to handle. So I think life has been complicated enough, so I don't think we need to complicate things more. But depends on the demand. I think for the next few weeks or so, we will have a better idea as to how to deal with billing process. Like Dr. Kading said, you know, there's some certain medical billing code we can use. For example, 99, don't quote me wrong, 99202 or something, start with a 99 code would be an appropriate one for medical follow-up visit, particularly for Ortho-K lenses or soft lenses as well.
Okay, that's a really good heads up. So as we come to a close, Dr. Chan, do you have any comments at all that you would like to make to our viewers regarding how to manage their Ortho-K patients today and what to look forward to in the future until we get back to normal?
Yeah, so I think when we first start with Ortho-K patient, especially if they have a mindset coming in, I want my kids to have Ortho-K lenses. So those, in my opinion, are one of the most difficult patient, so-called so difficult, just because they have a really high expectation for us to meet. And for that, you know, we typically want to set up a mental roadmap for us to follow. What I mean by that is, you know, whenever we start a patient with Ortho-K, don't just put the lenses on their eyes and, you know, just see how things go. With that mindset, you don't actually know what to expect and what to look for if something went south. So for me personally, whenever I design a lens for a patient, I typically want to have something I can think of, you know, or something I should expect to happen if something went wrong. And so by that case, you know, during this crisis, when we're not able to see patients in person that often, we do have to give them a checklist as to know what to look for. Specifically, I'm telling patient, okay, if you have any signs of, you know, scratchiness or pain or light sensitivity, all these things could be relative to the corneal abrasion or mishandling with the lenses. Whereas like a patient have any other issues such as, you know, the lens are not fitting properly, leading to some sort of vision fluctuation during the day. I ask them, okay, mark it down, whether you have vision problem more during the day versus during the nighttime. That way we can kind of know what to do, whether it's about the lens issue, whether or not it's about a wearing off issue. All these things could be relative to, you know, how we can approach the patient.
Okay, that's excellent advice. Dr. Kading?
Yeah, you know, I think the big thing here is to just be prepared for when things start back up. For our patients, how are you going to be addressing them? But this is also a really good time to be thinking about your marketing methods for what you're going to do afterwards. You know, coming up with methods. You know, we've discussed in our doctor teams about coming up with some quick videos of insertion and removal. You know, how do our documents look for preparing for when this is over, so we can streamline the approaches and see patients more efficiently. And I don't say that to, you know, make it so that the patients get a quicker experience, but a better experience. And how can we look at things and make it a little bit easier? So, you know, beyond that, I think we just make sure patients feel like they're taken care of. And I think we're doing all a really good job with regards to that. Within our practices, and you know, when things start back up, just make sure that we're managing myopia as effectively as we can.
Okay, really, that's fantastic advice from both of you. I would like to mention to our viewers that this conversation can continue. The video feed of this as a recording will be on the Euclid website, and you can continue to ask any questions that you might have there. That would come up. Maybe we would pass them on to our two esteemed guests, or somebody else would be able to answer those for you on the Euclid Facebook page. Dr. Kevin Chan, Dr. David Kading, thank you so much. This is really an enlightening discussion on the topic of how to manage OrthoK patients when you're not in the office. Please, to both of you, be safe, to you and your families. And really look forward to sometime in the future actually sitting down together rather than a virtual conversation. Thank you guys very much.
Thank you so much.
Thanks, Craig. Good seeing you, Kevin. All right.
Bye-bye.
All right. Talk to you soon.
Yeah, bye-bye.
Bye-bye.